Welcome, everybody, to the Firebrand Podcast. This is Grant McGaw. And this time, I'm going to take it all the way for myself and my family in the Midwest. I'm going to dedicate this show to the Santee Sioux tribe of Nebraska, the Dakota Nation. This is my family. A lot of people don't know that my ex-wife actually is a tribal member from the Santee Sioux tribe out there, just a little bit north of Omaha, Nebraska, a little bit to the south in the Minnesota, South Dakota area, a little bitty corner of that Nebraska world is where the Dakota Nation is. I have three children. They're all tribally enrolled. And I bring that up because we're going to be talking about some business and technology in the Native American world that a lot of people are not aware of, and I want to bring light to, especially when I have somebody so articulate and really lives in this world. And I want to bring to the mic right now, Miss Monique Allen, because she has been working tirelessly to bring this story to light. So, Monique, would you like to introduce yourself?
Yes, thank you so much again for having me on the show. My name is Monique Allen. I am the CEO and founder of a company called Ma'at Enterprises. We are a woman-owned, tribally owned business that specializes on making our mission to improve the lives of Native Americans. And we are currently staffing Indian hospitals across the nation and doing some other amazing things with some alliances that we formed.
Well, thank you again for being on the show. And I'm sure a lot of people in my audience right now are wondering, Ma'at, M-A apostrophe A-T. That's the name of your company. And it represents truth, balance, justice in ancient Egyptian culture. I want to know, and we would like to know, how do these values shape your leadership and company mission today?
Well, when I was looking for a business name, I think it's most people typically name their companies either after themselves or they try to, make some type of connection from a personal standpoint. When I started studying the concepts and the 42 principles of Ma'at, it really resonated with me. As a person, I view myself as more of a servant leader. So it's not so much a dictatorship. What my goal is to be just a light in this world. Like I want my energy to be reflective of someone who made a positive impact. None of us are perfect, but I think that as we try to strive and live our best lives every day and showing up and trying to be the best person, those 42 principles resonated very closely to my heart. The whole concept of Ma'at and the Egyptian goddess, I've always viewed myself as a child of God. And, what better name than to encompass something that I've already viewed myself as. And then I want to share that concept and those principles with others in the world.
Now, you're also of Native American background. You shared the story with me a little bit about, part of the Cherokee Nation, people from Oklahoma. How do you bring all of that together to now to be a service leader? I'll say service and a servant leader in the space that you are in now.
Well, it's kind of an interesting but long story. I'll get into some of it in an abbreviated fashion, but um, the part that I didn't share with you is that I actually had a kidney disease when I was born with one, and I only have one kidney. So just to kind of contextualize this story, it started with my life. Pretty much, I lived my childhood in a hospital. So growing up, my mom was always being told that I was not going to make it past the age of 12. So here I am at the age of 53. It's like neener, neener, neener. Whatever death the physicians had on the calendar for me, God said otherwise, right? So initially, what ended up happening is when I was at UC Davis, I wanted to be a doctor. So by the time, I start having these aspirations of because I had a kidney disease, I wanted to be a pediatrician. I was just familiar that world was of a comfortable world for me. So I decided in my studies to try to pursue being a doctor until I nearly blew up the lab at UC Davis. So that didn't work out. And I was like, okay, little girl, I think you need to go into administration. We're going to go into a different aspect of healthcare. I don't think, being a pediatrician is really the road for you. And in going down that route, I was looking for my roots because I wanted to work on a tribal reservation, give back, set up my own clinics out there, and then, make an impact that way, and then go out into the regular commercial space and be able to help communities from that standpoint. Well, in the search for who we were as a family, it came out that my mom, who initially did not know her biological father, we realized that my mom, she was born like in a home in Muskogee, Oklahoma, tribal area, and she's part of two tribes. So I'm sitting here thinking that it's my father's side of the family. I knew that there was something going on there, but in hindsight, we realized that it was my mom. My mom is, now the matriarch of our family, and she's getting to know, her people from that side of the tribe and all of these contacts. And so we were able to take that information, and with it, I had been working at various hospitals all over the Bay Area. So I've worked at UC Davis Medical Center, Stanford. I was part of the team that implemented the first physician order entry system. So I've always had a mindset to be in the healthcare field. And then by the time I decided to, go into healthcare technology, I'm a tech girl at heart now. I decided to step out on faith and start my own company because I, did some research and found out that there's a lot of economic Indian opportunities out there where they are trying to get us to come to the table with businesses and entrepreneurship opportunities. So it's amazing to start this story off with, I didn't even know that I was going to make it past the age of 12, wanted to be a doctor, and now I'm staffing hospitals with nurses, looking at bringing in physicians and other pieces of technology to make an impact in Indian country.
And now we got a juicy story, right? This is a great story as you have had to overcome challenges, just having a life on this planet, and then getting into healthcare, then understanding your Native American roots, then having philosophies embedded, in ancient Egyptian culture. And now you've noticed that, yes, there is a opportunity to help out in a lot of these tribal reservations. A lot of them are remote. A lot of them definitely are in need of healthcare and healthcare type applications. Now, we also know that being a woman-owned business, we know there's unique challenges with that. So when you're building out Mont Enterprises, when you're engaging with these communities, how did you overcome the challenges?
We're still trying to overcome the challenges. So, as you know, even with your family and the conversations that we've had, there is not a lot of trust trying to make an impact on tribal reservations, and for good reason. So, for every treaty that's been established with Native Americans, we know that it's been broken, right? So, if I'm trying to go in and say to them, listen, we can offer you remote patient monitoring services. We can offer you, a mental health application that would allow you to be anonymous to start treating the addictions that we see on the tribal reservations. They don't want to hear about that. It's a situation where not only did I have to, everybody always wants to say, they want a seat at the table. I built my own table because nobody was going to give me a seat. So instead of crying about it, I just built my own table and decided, okay, I'm going to have to overcome these challenges. And I'm doing that by first proving, to be a leading service provider to Indian Health Services. So under the government contracting space, I feel like if we can be trusted there, because a lot of Native Americans are coming to IHS, that's the acronym for Indian Health Services. They are coming to IHS for their care. So if they start hearing about Ma'at as a preferred vendor there, then we can use that as our track record and past performance to say, hey, let us come in. We're not just trying to colonize your data. We are not just trying to colonize anything that you have going on the reservation. What we want to do is really make an impact, but let's work together and make you the owner of all of this and your journey. And I think that as we start to get this message out that Ma'at wants to be a partner, we don't want to necessarily just lead you to water. We want to partner with you and figure out, is the water source best for your tribe, or do we take a different avenue? So when you say how are we overcoming those challenges? I think that we are still working that out. I think that God is going to provide the right alignments. I feel like I am definitely living a life of answered prayers right now. I thought about this stuff, manifested it years ago, and here we are. So this is just yet another challenge that God is saying to me, hey, we know that we have these opportunities as long as you're bringing it to them with a pure heart. And the agenda is really just to make a positive impact. I think we'll get there. And it's okay if every tribe doesn't, want to embrace that. That's okay. But at least I can say that I gave it the good old college try and said, hey, we have these, resources. We want to share them with you. And it's not just because we're trying to hustle and make $1 off of you as well.
I'm glad you said that. It's so important to understand the context of where you're operating in. A lot of people, they love Native American culture. They see it mainly, from a stereotypical, I'd say, lens of what they see on television, what they may have read in a book or not a book. And because this is a lived experience for me, and it took a while for me to really understand, let's say, my wife's perspective. When people are looking at you as like you're some mythical creature from the past or something to that effect, like, no, we are a consistent lived experience. And our lived experience has been, the interaction with what you call modern culture today has not been great.
No,
It's not been great. You got to remember 150 years ago, the Dakota Nation was living as an independent tribe of people. And the
right.
way that the American government, the BIA, Bureau of Indian Affairs, they look at each individual tribe as a separate sovereign nation, which
Mm-hmm.
in of itself, especially in today's world, has its complications with it and how you get services like you're describing, because each tribe is individual in its own aspects, right? And they have their own history and their own cultural aspects. This is a nation of people who were, rudely interrupted by a different culture, was then, as you said, colonized in a very rude and inhumane manner, taught to not speak your language, to not participate really in your culture at all, to adopt my language, to adopt my culture, and adopt how I view you, which was not very good, and then send you back to this, what we call the reservation, which really is a POW camp. You were put out there in the middle of nothing to really be dependent completely upon government handouts for your survival, because your way of life was no longer in effect. You had no other choice but to live in this manner. And a lot of the treaties for your land, per se, it's not like the tribes were not had something of value. They definitely had something of value that they extracted from them. And in return, they gave them very, very little. So there's a lot of distrust in these tribal nations when it comes to interaction, because every single treaty, as you stated earlier, has been broken. Everything that this culture has stated that they're going to do for you, they have gone back on. So every time they came to the table, as you said, with an agreement that was honored on one side, but not on the other. So now when you come to the table and say, hey, I am Mahat, and here I come to the table, I am Monique Allen, I'm here to help you. Of course, they're going to look at you. They're going to look at what's behind you like, oh, okay, I don't know how. I think you come in good spirit, but really, is this going to? Do you going to get the backing? Is this going to really come to fruition? You talked about even some different contracts recently about broadband, to bring broadband out to these communities through the government, through grants that we're still looking for today. Can you talk about that just a little bit?
Absolutely. So under the Biden administration, And I think this was going through a couple of administrations. There has been a concerted effort to improve life on the reservations. So there was, I believe, a $900 million contract out there with the Department of Commerce, where they were supposed to be partnering with tribes and bringing basic broadband services to the reservations. And one of the requirements is that you had to partner with a tribe to do this, correct? And doing that, they never received the services. But you can best believe that the consulting companies, they're still working with the dollars that were given to them. We don't know where a lot of these projects are in terms of, their advancement. But what my point in all of this is, it's 2025. Why are we still needing to spend 900, that type of money, just to bring basic services? You're talking about some tribes who don't even have clean water. You're talking about, basic living necessities that a lot of tribal members, they're suffering. And then you've got some of the richest tribes in the Midwest, like Minnesota. They have, a very wealthy tribe out there, and they're utilizing their resources very well. So when somebody like me comes to the table, the first thing they're going to say, well, are you working with Cherokee Nation? Are they picking up, any of these resources? Are they working with you? And they're looking at it from the standpoint, well, if your own tribe isn't really picking this up, why should we work with you? Or, they feel like they can't just trust anybody coming in. And I understand that. But I think from the standpoint of what the government is trying to do, I think that, eventually there's going to have to be some type of trust established to get things done, because we can talk a good game, but if we're not really coming to the powwow with tree resources, and we're just saying, bringing a chair to the table and saying, oh, I really want to help, you then get the money and you never provide the help. It's just this repetitive cycle. And I appreciate the fact that you're bringing up this conversation. It's a very sensitive one. But I think too, it's almost like the tribal leaders, they're coming together to fight some inherent discriminatory things that are going on in Native country right now. But I think overall, it's still just, it surprises me that we are in this shape, given the fact that the United States considers itself to be one of the greatest nations in the world, right? And we've got tribal reservations that don't even have broadband and clean water, that are trying to figure out how to fight addictions. I mean, we're trying to figure that out outside of the community. It impacts all Americans, when you start getting into the issues of addiction and drugs, which reminds me, I kind of want to touch on one of the alliances. Is like, there's so many resources out there where we can do testing with like genomics, and you're very aware of what they're doing with frenetic, right? I had a conversation with a tribe that was based out of Nevada to try to get them to pilot some of these opportunities. They don't want to hear it, because the first question they have is, okay, you want our DNA, you want to provide all of this testing, you want to, look at our gene pool. What are you going to do with that after you're done? Do we own the data? I was just at HIMSS last week, and we were showcasing Ma'at for the first time. And I typically have attended that, more as an attendee and not as a business owner. But that was one of the first conversations we had, at the Native American workshops. Everybody was up in arms trying to figure out, well, even if you determine that they're not trying to colonize the data, who's in charge of their health record? Is it the individual, or is it the tribe? Does the chief get to decide they're going to share everyone's data, or is it that individual person? And I stood up, at that session, and I said, when I worked with the government, that was one of the things that we looked into. The privacy rules, when it comes to how your health information is shared, it comes at the individual level. You have to empower people. You cannot make them feel like you are taking control of them and they have no power over the information that's being shared. So how do we get them to embrace the idea of having, their genes tested, so we could tell them, well, we can tell by this that, your family is prone to diabetes, or, somebody like me who has a kidney disease. I had a baby cousin who it happened to her. Everyone in the family was trying to figure out, where did this come from? And nobody had talked to me initially. And when I found out she was in the hospital, she was probably about 4 or 5 years old at the time. I said, I had a very similar kidney disease, and it's on our father's side, because that was the connection between me and the baby cousin. And I said, it had nothing to do with like my mom's side, but had we, been able to embrace something like, genomic testing, or getting out there and bringing in these technologies that can help us prevent these type of illnesses, I think we can make some headway. So it's a deeper conversation. There's so many different problems to be solved in Native country that we have to prioritize it. But just to have basic clean water, food, jobs, broadband so you can look for the job, transportation, housing. When you can solve those problems, then they'll probably start looking at embracing, modern day technology to solve some of the other problems.
You have unpacked it. I mean, that is the issue and the problem, and understanding a people, a people in their own country. It's not like they are people in someone else's country. They are in their own country, have been a sovereign, independent people for a long time. There's a lot of pride there, right?
A lot.
So just like a lot for my own, African-American heritage, you don't really want a handout. You want a hand, understand first, how did I get in this situation? And what was the root cause of that? And has that truly been ever really addressed? I didn't just fall into this situation. I was pretty much forced into this situation, and then trying to now navigate this situation. And each time, who I feel was at fault would try to, rectify the situation, they failed miserably. And probably because they just don't have the right intentions at heart. Let's just call it what it is. It shouldn't take, to your point, this is 2025. We're talking about something that happened, in the early 1900s. So why is it taking 125 years to, first of all, acknowledge, why do I have a poor living situation? How did this happen? Because what people fantasize about Native American life, when you look at it prior to European content, they weren't poor.
No.
They weren't impoverished. They weren't sick. They didn't have disease, and they didn't have alcoholism.
To them.
So now you're like, maybe it's me. And maybe if that was acknowledged at first, and I always start at the very root of that, did you even apologize for this behavior? You say, you know what? I see where you're at. I see that I am definitely a cause of that. And the things that I've done to try to help you along that path really have been bad. And I haven't done a good job. I want to do better. I want to show you I want to do better, but I want to allow you, the sovereign nation, to tell me, how do you feel we should help you? Instead of me telling you what I think you should do, why don't I listen for once, listen and let you explain and tell me your story. And let's just see if we can be of some help. So with that said, tell us about what Mahat actually does and how you can be of service.
Well, thank you for asking that question, because that's one of the things that I'm most proud of. Where we are right now, we are providing staffing. So we do a lot of healthcare staffing at the Indian hospitals across the nation. I mentioned that earlier. But one of the things that we're most proud of is to be able to provide staffing specifically for, those locations. Our biggest client is Phoenix Indian Medical Center, and also out in Bemidji. The other alliances that we formed that I'm so super excited about. It goes back to that story of wanting to work on the reservation as a doctor and everything else. I was selected and asked to be an advisory board member to an organization, an amazing organization called Hospitals Without Borders. Hospitals Without Borders has the ability to stand up modular clinics in a matter of days, not years. We've got tribes out there that are currently building medical centers that are going to take, millions of dollars to build, a little couple of years. We are modeling a concept where you can order a modular clinic and it can be stood up in a matter of 3 to 4 days. So think in terms of like, I'm aging myself when I say this, but like, the old school TV show MASH. Yes. So if you've got situations like what happened with the fires out out here in California, we could have stood up a modular clinic for them, a fully functioning surgery center, a pediatric clinic. They just worked to provide the Vatican with a pediatric clinic as well. So one of the things that we're doing with Ma'at is providing that as an opportunity, for the tribes and IHS. We want all organizations to come to us and have a conversation about how can we best serve those needs? Because if you don't have health, you don't have wealth, right? That's the most, outside of time, I always tell this to people, the most priceless commodity that we own is what? Time. And then second after that is our health. So we know that healthcare is a multi-billion-dollar business. Illnesses and things like that are not going anywhere. But if we can position ourselves to be a leader in being the most responsive company out there in areas of staffing, and then we can now stand up a clinic for you. Hey, I would consider my work done if we can make an impact in that area. Additionally, one of the things that we're looking at is telehealth. I have an alliance with a company called Compsys, where we can provide a lot of virtual diagnostic testing and opportunities. A lot of times it's hard for us to get staffing out there in the remote areas. So for example, like the contracts in Montana that we have in these remote areas right now, there's areas in Arizona where they are calling for a nurse to take a helicopter and use a donkey to get up a road and provide staffing. So imagine if we could just get, some of these folks to embrace the idea of telehealth, where if nothing else, they can use the broadband that they need access to, and to dial in and at least get an initial screening. And then we can figure out how do we get them in for services. There's a company called Resonance where they built an app. You can cough into that app and it can give you a cursory screening of, do you have COVID? Do you have TB? Do you have RSV? And, for FDA purposes, they can't diagnose you, with the app, but at least a clinician can get a reading of that. It's then sent over and the doctor can say, okay, I need you to head to the ER right now, because based on how you sound, you sound like you might have something pretty serious that needs to be treated at a medical center. So when you look at Ma'at sort of being, the triangle and the connector to all of these different opportunities, that's the goal in terms of the services and the provisions that we're trying to make for the community. My goal is to be one of the most responsive companies out there, not just to Native Americans, but to anybody that's in an underserved situation. I want to be there. I want to be able to help, because I've been on the other end of that. Nobody is really promised tomorrow, but when they tell you that you're not going to make it past a certain marker in your life, things become a little bit urgent. And so that's that urgency for me is like, okay, yeah, I got past the age of 12, but what can we do to make an impact on the community? How can we really help and not just come in with an agenda and say, oh, well, let me just, sell you these clinics. Are these clinics, excuse me, are these clinics going to be viable? Are they going to really help the community? And at what cost? So I'm really excited and happy to be working with these organizations. I don't often, I always say, I prefer to walk alone, so to speak. I don't do a lot of partnerships because one thing I'm very careful about the people that, I form these alliances with. But I understand that I also can't do it alone. So with that in mind, I have to make sure that the partnerships that we establish as a company, that they align with not only the mission, the value, and the purpose of my aunt, but just with me as who I am as a person and as a leader. Because I don't want you, I'm not going to let people do what I wouldn't have them do to me and my community, me and my family. I'm very protective of that. So I feel like any organization that we're working with and serving, I want to make sure that I'm protecting them as well.
100% on that. You have to have positive alliances. I love
Yes.
how you talked about that circle, that wheel of life, that circle of life, time, right? And that in that circle, you've got health, you've got wealth, and you also have relationships. Very important. So when you look at the body of work of an alliance that you may have, it tells the story. It
Yes.
leaves the breadcrumbs, right? The path that you've already been walking on. Is this a path that are going to coincide with what you're doing to be of assistance? And you're right. There's so many rural communities throughout America that just don't have the resources when it comes to healthcare, right?
No.
From a technological plane. And when you look at technology, it actually works in two areas, if people really think about it. It's time, the collapsing of the window of time, speed to market, and then communication. Very, very good at different modalities of communication. So when you marry those two together to enhance healthcare, to enhance wealth, to enhance relationships, you can do certain things, but you have to have basic infrastructure, as you just talked
Yes.
about. That's really at a point. And I want to talk to my the we call the majority population, and they tune into my show and try to put yourself in the shoes of our Native American people. Is that we are in what we call a first world environment, right? We're a $30 trillion economy. We're the largest economy on earth. Yet the indigenous population here lives in third world poverty. And you wonder why. Why is that? How come 360 million people can't be operating in the $30 trillion economy at scale? Why is that? What are we doing? Is it because we've just left them behind and we only look in the past at different history books and not want to go outside your own door, go drive out to a reservation and actually see what this looks like? And this is the result of ancestral challenges in the past that are still present today. I want people to truly understand the impact and the implications of all these different things that have happened over time that are still prevalent today, and that we have people like Monique Allen who say, hey, I see the situation. It's not going to just get solved in a boardroom. We got to get out in the trenches. We got to get out and we got to talk to people and find out what's on their agenda. What do you feel that we can do? And then, oh, by the way, this is something I can do for you. You're like, okay. And it's going to come down to that one thing. Well, what does it cost me? And now we're not talking about money, is in who I am as a person, my own heritage, how I am. Because this is the only thing that has allowed people of Native American descent to survive throughout this time period is their own particular form of faith and heritage. And they're not going to sacrifice that for anybody. So it has to be an alignment in that world, and then a healing can take place. I'm so happy that you're sharing exactly what you're doing from a Mahat perspective. And before we conclude this conversation, as we bridge a lot about innovation and culture, and then the impact on tribal communities, and you've talked a lot about your project, things that you're doing. I want to know about your particular leadership style and how you're going to bring a new future forth for your particular business.
Well, my strategy at this point, it's been working quite well for me in terms of the contracts that we have right now, right? One of the things that I'm very proud of is because I lead by these 42 principles, it's really all relationship based. So my goal is to forge and align myself with energies that kind of match mine, where we all want to make a difference. We all understand our part in the story, and that there's no competition, so to speak, in trying to build this out. Whenever I've been interviewed for like past stories and press releases and things like that, one of the things that I always like to talk about is sometimes you have to build and be your own Mount Rushmore. And that's what I'm looking at this as. I am trying to build our own Mount Rushmore. And from the standpoint of bringing together the right people, that I think that is the core of the strategy. It's like, okay, Monique, you know that you cannot do this by yourself. And it's almost like, when you form these partnerships, it's like a marriage. You have to make sure that those are the right people that you're bringing to the table to help advance this, because we become a family. You become your own village, right? So I have to make sure that these tribes not only trust me, but that they also trust every partner that I'm bringing to the table. So in order for that to happen, there's a vetting, there's interviewing and understanding like who they are at their core. And it's not just about, oh, I had a company approach me when I first got into this, just providing the staffing, and they wanted to partner with me, but it was because they had got removed from the contract and they were trying to, do a set aside for Indian enterprises, right? There's not enough Native American companies out there that are doing this, and that's okay. That we're part of a small group. I am proud to be part of that small group, but I'm also not going to turn around and let another company come back in and colonize my aunt for money. And it's really based on the value, the value add that we're bringing to the table. So when you ask me that question, it's a lot of thought that I have to put into what are the relationships that I want? Who are the people that I want around me? One of my daily prayers, and I have no shame in saying this, I'm always asking God to keep me invisible to the people that don't mean this company and anything that I'm doing any good. Make me visible to those that I'm supposed to be in alliance with. And as long as I keep trusting him, I think that's going to happen. And I think that's the core of my strategy is my faith and understanding that no, you're not superwoman. You can't do this by yourself. Eventually, you have to forge those relationships, but make sure they're the right ones so that we can really make an advancement in the community and work together. So I want to be, a trusted source for the Native American community. And that's my goal. I feel like if I can be the trusted source, then, brick by brick, as everybody likes to say, social media, I'm building my For You page and my life around this whole concept.
That is beautiful. That is so aptly stated. That brings us to our conclusion. I couldn't have, ask you to say that any differently. And before I let you go, I always ask this of my guests. Now you're toward the end of the podcast. How did you feel about this interview?
I feel amazing about this interview. You have really given me a platform to tell the entire story. I usually leave bits and pieces out, and I feel like I finally was able to share the entire message. And it's like, I don't want to be a misery merchant and live in the past, but I understand the past and how it got me here. And I understand the reason why God saved my life past the age of 12, because I was sent here to be a generational blessing. So I appreciate the fact that you gave me this platform to be able to tell the entire story. Thank you.
That's a blessing for both of us. That is awesome. Thank you for sharing your story. I'm sure the entire Santee Sioux Nation out there in Nebraska thanks you for sharing the story. Tell them how to contact you. What is the best possible way?
We have our website, or you can send me an email at info@maat, MAAT hyphen enterprises.com. We would love to hear from you. I would love to hear some feedback. If you've worked with our company before and you have some feedback on how we can do certain things better, I'm very much open to that. My goal in life is to make sure that, we can't please everybody. We're not tequila, but at the end of the day, at least if we can do, a semi good job in listening to who's out there, that's how you can get to us.
Excellent, excellent. And I want to encourage your entire network to tune into all the episodes of Follow the Brand. You can do so at the number 5. That's star, STAR, BDM. That's B for brand, D for development, Infomasters.com. I want to thank you again so much for sharing your story on the Follow the Brand podcast and TV series.
Thank you for having me.
You're welcome.